Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
Preoperatively, the nurse develops a plan to prepare a 7-month-old infant psychologically for a scheduled herniorrhaphy the next day. Which of the following should the nurse expect to implement to accomplish this goal? 1. Explaining the preoperative and postoperative procedures to the mother. 2. Having the mother stay with the infant. 3. Making sure the infant's favorite toy is available. 4. Allowing the infant to play with surgical equipment. The correct answer is 2. The best way to prepare a 7-month-old infant psychologically for surgery is to have the primary caretaker stay with the child. Infants in the second 6 months of life commonly develop separation anxiety. Therefore, the priority in this case is to support the child by having the parent present. Teaching the mother what to expect may decrease her anxiety. This is important because infants sense anxiety and distress in parents, but the priority in this case is to have the parent present. Actual play and acting out life experiences are appropriate for preschool-age children. Allowing an infant to play with surgical equipment would be inappropriate and dangerous. What should the nurse teach a client about how to avoid the dumping syndrome? Select all that apply. 1. Consume 3 regularly spaced meals per day. 2. Eat a diet with high carbohydrate foods with each meal. 3. Reduce fluids with meals but take them between meals. 4. Obtain adequate amounts of protein and fat in each meal. 5. Eat in a relaxing environment. The correct answers 3, 4, and 5. Dumping syndrome results in excessive, rapid emptying of gastric contents. The nurse should instruct the client to avoid dumping syndrome by eating small, frequent meals rather than 3 large meals, having a diet high in protein and fat, and low in carbohydrates, reducing fluids with meals but taking them between meals, and relaxing when eating. The client should eat slowly and regularly and rest after meals. A client with suspected gastric cancer undergoes an endoscopy of the stomach. Which of the following assessments made after procedure would indicate the development of a potential complication? 1. The client has a sore throat. 2. The client displays signs of sedation. 3. The client experiences a sudden increase in temperature. 4. The client demonstrates a lack of appetite. The correct answer is 3. The most likely complication of an endoscopic procedure is perforation. A sudden temperature spike within 1 to 2 hours after procedure is indicative of a perforation and should be reported immediately to the physician. A sore throat is to be anticipated after an endoscopy. Clients are given sedatives during the procedure, so it is expected that they will display signs of sedation after the procedure is completed. A lack of appetite could be the result of many factors, including the disease process. A client with a peptic ulcer reports epigastric pain that frequently causes the client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1, 2, 3, and 4. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension, if not actively bleeding, and decreases distension and release of gastrin. Medication should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client, which instructions about positioning would be appropriate for the nurse to give a UAP. 1. Keep the client in a sideline position with the head slightly elevated. 2. Do not reposition the client without the assistance of a registered nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client, unless the client's condition warrants the presence of a nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for the client. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is planning care for an elderly client with cognitive impairment who is still living at home. Which action should the nurse identify as a priority for safety in planning care for this client? 1. Having 2 people accompany the client whenever the client is up and about. 2. Ensuring the removal of objects in the client's path that may cause him to trip. 3. Putting the client's favorite belongings in a safe place so that he will not lose them. 4. Giving the client his medications in liquid form to make certain that he swallows them. The correct answer is 2. When caring for a client with cognitive impairment, the priority is to ensure that all objects in the client's path are removed to prevent the client from falling. Additional measures, such as having 2 people accompany the client when he ambulates, placing his favorite things in safekeeping, and giving medications in a liquid form to be sure he swallows them, are less crucial and available. When helping the families of clients with Alzheimer's disease cope with vulgar behaviors, which of the following suggestions is most helpful? 1. Ignore the behaviors, but try to identify the underlying need for behaviors. 2. Give feedback on the inappropriateness of the behaviors. 3. Employ anger management strategies. 4. Administer the prescribed risperidone. The correct answer is 1. The vulgar behaviors are commonly expressions of anger or more sensual needs that can be addressed directly. Therefore, the family should be encouraged to ignore behaviors but attempt to identify their purpose. Then the purpose can be addressed, possibly leading to a decrease in the behaviors. Because of impaired cognitive function, the client is not likely to be able to process the inappropriateness of the behaviors if given feedback. Likewise, anger management strategies will be ineffective because the client would probably be unable to process the inappropriateness of the behaviors. Risperidone may decrease agitation, but it does not improve social behaviors. While assessing a client diagnosed with dementia, the nurse notes that her husband is concerned about what he should do when she uses vulgar language with him. The nurse should 1. Tell her that she is very rude. 2. Ignore the vulgarity and distract her. 3. Tell her to stop swearing immediately. 4. Say nothing and leave the room. The correct answer is 2. Vulgar language is common in clients with dementia when they are having trouble communicating about a topic. Ignoring the vulgarity and distracting her is appropriate. Telling the client she is rude or to stop swearing will have no lasting effect and may cause agitation. Just leaving the room is abandonment that the client will not understand. The nurse is assessing an older adult for signs of dementia using the Mini-Cog Dementia Assessment Tool. The nurse gives the client 3 words to remember: cat, crackers, and toys. After having the client perform a short task, the nurse asks the client to repeat the words. The client says toys, boys, and joys. The nurse should next 1. Ask the client to repeat the original words one more time. 2. Note on the chart that the client has echolalia. 3. Refer the client to a healthcare provider for further follow-up. 4. Repeat the test when a family member is present. The correct answer is 3. That the client is not able to recall the 3 words is a likely indicator of dementia. The nurse should make a referral for further testing. It is recommended not to repeat the test a second time if the client is not able to recall the words. Although the client repeated rhyming words, echolalia refers to repletion of the same word. It is not necessary to have a family member present when conducting the test, but the nurse should communicate the findings to the family and encourage them to seek follow-up assessment. The nurse is explaining the medication options available for pain relief during labor. The nurse realizes the client needs further teaching when the client states which of the following: 1. Nalbuphine and promethazine will give relief from pain and nausea during early labor. 2. I can have an epidural as soon as I start contracting. 3. If I have a cesarean, I can have an epidural. 4. If I have an emergency cesarean, I may be put to sleep for the birth. The correct answer is 2. Typically, a client will be able to have an epidural when she is 3 to 4 centimeters dilated or the active phase of labor has been established. Waiting until the cervix is dilated to this point ensures that the client is in labor and the epidural is less likely to halt labor contractions. Nalbuphine and promethazine are used to provide relief until the client is about 7 centimeters dilated. If given after this time, narcotics may cause neonatal respiratory depression in the neonate. The majority of clients have an epidural or spinal for cesarean section. The only time general anesthesia is used is for an emergency cesarean section. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. While the nurse is caring for a multiparous client in active labor at 36 weeks gestation, the client tells a nurse, "I think my water just broke." Which of the following should the nurse do first? 1. Turn the client to the right side. 2. Assess the color, amount, and odor of the fluid. 3. Assess the fetal heart rate pattern. 4. Check the client's cervical dilation. The correct answer is 3. After spontaneous rupture of the amniotic fluid, the gushing fluid may carry the umbilical cord out of the birth canal. Sudden deceleration of the fetal heart rate commonly signifies cord compression or prolapse of the cord, which will require immediate birth. This client is particularly at risk because the fetus is preterm and the fetal head may not be engaged. Turning the client to the right side is not a priority action. However, changing the client's position would be appropriate if variable decelerations are present. The nurse should assess the color, amount, and odor of the fluid, but this can be done once the fetal heart rate is assessed and no problems are detected. Cervical dilation should be checked, but only after the fetal heart rate pattern is assessed. A 31-year-old multigravida client at 39 weeks gestation, admitted to the hospital in active labor, is receiving intravenous lactated Ringer solution and a continuous epidural anesthetic. During the first hour after administration of the anesthetic, the nurse should monitor the client for 1. Hypotension, 2. Diaphoresis, 3. Headache, 4. Tremors. The correct answer is 1. When a client receives an epidural anesthetic, sympathetic nerves are blocked along with the pain nerves, possibly resulting in vasodilation and hypotension. Other adverse effects include bladder distension, prolonged second stage of labor, nausea and vomiting, pruritus, and delayed respiratory depression for up to 24 hours after administration. Diaphoresis and tremors are not usually associated with the administration of epidural anesthesia. Headache, a common adverse effect of many drugs, also is not associated with administration of epidural anesthesia. A child is started on a soft diet after having been on clear liquids following an episode of severe gastroenteritis. When helping the mother choose foods for her child, which of the following foods would be most appropriate? 1. Muffins and eggs. 2. Bananas and rice cereal. 3. Bran cereal and a bagel. 4. Pancakes and sausage. The correct answer is 2. After clear liquids, the foods of choice are soft foods. These foods should be easily digested and low in fat. Additionally, the food should be non-bulk forming. Bananas and rice cereal are low in fat and easy to digest. Muffins and eggs, as well as sausage and pancakes, are typically high in fat and will be avoided. Although a bagel is low in fat, Bran cereal is high in fiber and would be avoided because it may cause more diarrhea. The primary care provider prescribes an intravenous infusion of 5% dextrose in 0.45 normal saline to be infused at 2 milliliters per kilogram per hour in an infant who weighs 9 pounds, or 4.1 kilograms. How many milliliters per hour of the solution should the nurse infuse? Round to 1 decimal. Blank ml per hour. The correct answer is 8.2 milliliters per hour. You multiply 4.1 kilograms by 2. Since it's 2 milliliters per kilograms per hour, you get 8.2. An infant diagnosed with Hirschsprung's disease undergoes surgery with the creation of a temporary colostomy. Which of the following statements by the parent regarding the colostomy indicates the need for further teaching? 1. The colostomy is only temporary. 2. The colostomy will give time for the nerves to return to normal. 3. The colostomy may include 2 separate abdominal openings. 4. Right after the procedure, the stoma may appear purple. The correct answer is 2. The goal of the surgery is to remove the ganglionic portion of the intestine. The remaining intestines should have normal innervation. Colostomies are used to relieve the obstruction and allow the remaining intestines to return to normal size. A temporary loop or double-barreled colostomy has stomas for both the proximal and distal portion of the bowel. The final surgical repair is usually done when the infant is around 20 pounds. A new stoma is frequently swollen and bruised after surgery. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The primary care provider is able to reduce an infant's hernia and schedules the infant for a herniorrhaphy in 2 days. The mother asks the nurse why the surgery is not performed now. Which of the following responses indicates that the nurse understands the rationale for delaying the surgery? 1. Delaying the surgery ensures that your infant will receive the proper preoperative preparation. 2. We need to make sure that your infant receives nothing by mouth for at least 24 hours before the surgery. 3. Waiting these 2 days helps to allow any edema and inflammation in the area to subside. 4. Your infant needs to wear a truss for at least 24 hours before any surgery can be attempted. The correct answer is 3. If non-operative reduction is successful, delaying surgery for 2 to 3 days allows the edema and inflammation in the inguinal area to subside. Thus, the area to be operated will appear more normal, helping to decrease the risk of complications. The preoperative preparation for a herniorrhaphy is minimal and is not the reason for delaying the surgery. Typically, the infant is fed until a few hours before surgery to prevent dehydration. Trusses do not prevent incarceration, and there is no reason to use a truss preoperatively. A client who is recovering from a subdural gastrectomy experiences dumping syndrome. The client asks the nurse, "When will I be able to eat 3 meals a day again like I used to?" Which of the following responses by the nurse is most appropriate? 1. Eating 6 meals a day is time-consuming, isn't it? 2. You'll have to eat 6 small meals a day for the rest of your life. 3. You will be able to tolerate 3 meals a day before you are discharged. 4. Most clients can resume their normal meal patterns in about 6 to 12 months. The correct answer is 4. The symptoms related to dumping syndrome that occur after a gastrectomy usually disappear by 6 to 12 months after surgery. Most clients can begin to resume normal meal patterns after signs of the dumping syndrome have stopped. Acknowledging that eating 6 meals a day is time-consuming does not address the client's question and makes an assumption about the client's concerns. It is not necessarily true that a 6-meal-a-day dietary pattern will be required for the rest of the client's life. Clients will not be able to eat 3 meals a day before hospital discharge. The nurse should assess the client who is being admitted to the hospital with upper GI bleeding for which of the following? Select all that apply. 1. Dry, flush skin. 2. Decreased urine output. 3. Tachycardia. 4. Widening pulse pressure. 5. Rapid respirations. 6. Thirst. The correct answers are 2, 3, 5, and 6. The client who is experiencing upper GI bleeding is at risk for developing hypovolemic shock from blood loss. Therefore, the signs and symptoms a nurse should expect to find are those related to hypovolemia, including decreased urine output, tachycardia, rapid respirations, and thirst. The client's skin would be cool and clammy, not dry and flushed. The client would also be likely to develop hypotension, which would lead to a narrowing pulse pressure, not a widening pulse pressure. A client with peptic ulcer disease is taking ranitidine. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Histamine, 2 receptor antagonists, such as ranitidine, reduce gastric acid secretion, and a secretory or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms. A client who was in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate postoperative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. The priority of care in the immediate postoperative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.